Hi, I'm Shiv Glani. Thanks for checking out our Raise the Line interview series, in which me and my co-host, Osmosis Chief Medical Officer Dr. Rishi Desai, explore how to strengthen our healthcare system with some amazing leaders in medicine, technology, education, and government. And they have some great advice for people starting careers in healthcare as well. I hope you'll watch these highlights and then go listen to the full podcast interview wherever you get your podcasts.
I'm Dr. Rishi Desai, and today on Raise the Line, I'm happy to be joined by Dr. Deborah Trautman, President and CEO of American Association of Colleges of Nursing. I'd love to let our listeners and myself kind of learn a little bit about your backstory and what led you to joining the field of nursing in the first place.
Sure. So I am the second nurse in my family, actually the first baccalaureate nurse. I'm pleased to say that we now have two other nurses, so a total of four. The two most recent are advanced practice nurses. So I'm very proud of that. And how I became interested in nursing is not only one family member in particular, but one of my first positions of employment, I worked as a nurse's aide. And I was in a long-term care facility, and I was so impressed by the nurse who not only provided outstanding care to the residents that were in the facility, but she was extremely knowledgeable. She was a very strong advocate for the patients and their families, and she created a phenomenal work environment. And every day I saw her make a difference. And I thought, I want to do that. I want to be like that. And I hadn't seen the full scope of what nursing could do. And that was one of my first exposures. And I was just most impressed because of her leadership, her organization, and the expertise that she had.
We have a lot of folks in the audience that are students, that are early health career professionals. They're maybe just emerging. What would you tell them as they kind of start their journey?
Well, I hadn't planned to do this, but I'm going to share a quote because I love Doris Kearns Goodwin, and a quote that she has shared in a couple different audiences that I love is she said that the more and more she thinks about it, there could be nothing better in life than having work worth doing and doing it well. And I would say that most certainly if you enter nursing, you have work worth doing and you have a responsibility and an opportunity to do it well. I also believe that I didn't understand as much, I would say, when I started in nursing, is just how many doors can open in a variety of ways, and you continue to be a nurse. You could be a nurse scientist. You can be a nurse educator. You can be a practicing nurse. You can be a leader. All of these are important contributions that nurses make. And we lead in all positions. It isn't leadership by title. So I think that the breadth and depth of what is available to us is, number one, extraordinary. And we need smart, critical thinkers, compassionate individuals, diversity across all professions so that we can create really the healthcare delivery system and health promotion that everyone, especially in our country, that I would even say worldwide, deserves to have.
Thanks for watching this preview of Raise the Line. To hear the full interview, check out all of our podcasts and subscribe to the series. Please go to osmosis.org/Raise the Line podcast or listen wherever you get your podcasts.